A healthy set of teeth and gums are important for chewing and speaking. Practicing good oral hygiene can help prevent against pain and disease. Good brushing is important in removing the daily accumulation of plaque. We have been taught to do so twice a day. However, the act of toothbrushing may be difficult for persons with special needs. These persons may have poor memory, such as dementia, difficulty in swallowing, physical disability, for example, people who are recovering from a stroke or those with Parkinson's disease and other nerve disorders. These persons are more prone to infections and usually present with swallowing difficulties. They are at a higher risk of developing aspiration pneumonia. Aspiration pneumonia is a lung infection that develops when food or liquid that a person consumes is inhaled and enters the lungs. It can also occur when food travels back up the stomach and into the food pipe. If he or she is unable to cough up the inhaled content, bacteria can grow in the lungs and cause infection. Persons with aspiration pneumonia face increased length of hospital stays, costs, and need for treatment with antibiotics, which may result in antibiotic resistance. Good oral hygiene care will benefit them in the long run by reducing the risk of aspiration pneumonia. In this video, we will show you how to provide oral hygiene care for persons with special needs. You will need the following items to provide oral hygiene care: a toothbrush, toothpaste, mouth rinse or water. We recommend using a chlorhexidine mouth rinse for persons who are unable to rinse on their own, and water is recommended for persons with swallowing difficulties as they may choke easily. A single tufted brush is used to clean between the teeth or hard-to-reach areas, gauze to remove food debris, plastic cups for rinsing. Make sure you have all the necessary items ready before you begin. Stand beside the person and turn on all available light sources for improved visibility. If the person has swallowing difficulties, always provide oral hygiene care with him or her sitting up or slightly reclined. You are now ready to provide oral hygiene care. Before you begin, wash your hands with soap and water, or use a hand rub before donning gloves. Ask the person to open their mouth and check if there are any dentures. Remove them before you begin. Ask him or her to remove the dentures and store them in a safe place if they can do it on their own. The dentures will also require cleaning after you have completed oral hygiene care for them. Gently retract the lips and cheeks with your fingers. Use a gauze to remove all visible food debris on the cheeks and the teeth. You are now ready to brush the teeth. Dispense a pea-sized toothpaste on a toothbrush. If the person has swallowing difficulties, dip the toothbrush into mouth rinse or water. Use your finger to retract the lips. Angle the toothbrush bristles to the gum line at 45 degrees and jiggle the brush for 5 counts. Repeat this motion for every 2 to 3 teeth for all of the surfaces, but tilt the toothbrush vertically for the inner surfaces of the upper and lower front teeth. To clean the tongue, start by brushing the tip using the forward and backward strokes, slowly moving the brush backwards as the person becomes more comfortable. You can also use a gauze dipped in water or chlorhexidine to wipe the tongue if their gag reflex prevents you from brushing the tongue. Dip the single tufted brush into mouth rinse or water. Move the brush along the gum line in circular motions and in between the teeth. A single tufted brush is also helpful if he or she cannot open the mouth wide. Dip the gauze into mouth rinse or water. Wipe the gums, cheeks, and tongue daily using a damp gauze. Develop an oral hygiene care routine. Brush teeth twice a day. Allow the person to brush their own teeth as much as they can before taking over so they can be responsible for their oral health as well. Avoid using fluoridated toothpaste if they cannot spit or have difficulty swallowing. Lastly, remember that it is more important to use correct toothbrushing techniques than using toothpaste.